Kimberly Brown suffers from a number of medical issues, including a tumor in her breast. But as a practicing Jehovah's Witness, she refuses any treatment that involves a blood transfusion. Passages in the Bible forbid ingesting blood, and witnesses believe it contains the essence of a person's life or soul.
I was raised a witness all of my life. That's all I know. I have complete trust and faith that if anything happens to me, my family will be okay. But I'm human, and I do get nervous.
So when it came time to remove the tumor, in addition to God, she put her fate in the hands of Englewood Hospital. Here they cater to Jehovah's Witnesses and specialize in bloodless medicine.
Well, if it's a surgery where you expect high blood loss, then you may want to make sure that the patient is optimized, whether the patient needs to take iron, whatever, to build their blood counts up to prepare for surgery. If it's a surgery where we're not losing a lot of blood, then there's really nothing special that the patient has to do ahead of time.
Kimberly's procedure is fairly routine, but in an emergency, her beliefs take a common treatment option off the table. Her father and brother underwent open-heart surgeries here, also without transfusions.
The practice of treating patients without the use of blood transfusions was developed for those who have religious objections to them. But it turns out there are medical advantages to so-called bloodless medicine. And as a result, the number of transfusions in the United States is going down.
Doctors can bank or recycle the patient's own blood as an alternative, as was the case in this open-heart surgery. Because transfusions cause an immune reaction and blood can be contaminated, they come with risks. And in recent years, studies have confirmed what hospitals like Englewood have experienced firsthand. Less blood often leads to better outcomes for patients.
Some patients, that risk is worth taking because the good the blood might do for them may outweigh that risk. But estimates are that we probably give between 40 and 60% of transfusions in this country for no good reason.
And while Kimberly says she'd risk death rather than accept another person's blood, she's happy that science is finding alternative therapies that give her the chance to live without compromising her beliefs. Kristen Salumi, Al Jazeera, Englewood, New Jersey.